Hi, this is our Anatomy 2 project, and this is based on the endocrine system. This is an iPhone, or a little diagram of an iPhone, and this can be used as a really good study method between you and your other Anatomy 2 classmate. And I will show you why in just a moment, but for right now, I'm going to be talking about the communication between the posterior pituitary, the anterior pituitary, and the hypothalamus. So the hypothalamus asks the posterior pituitary gland to store things for it, and the posterior just stores things. And the anterior, however, makes things for like the rest of the body and the hypothalamus. So when you slide to unlock, this is little emojis which you should have on like an Android or an iPhone or any type of smartphone. And this is what I was talking about with the really good study method, because if you send these emojis out, after I explain them, it probably will make a little more sense. But when you send these emojis to your friends, they can repeat it back to you verbally, or they can tell you, okay, this is the hormone. So for the posterior pituitary, it has oxy and ADH. Now, oxy targets your uterus and your breasts, and the uterus causes labor contractions. And for the breast, it causes milk production. And this is also called the love hormone, because between the first sip of milk from the baby off the breast, it causes a stronger bond between mommy and baby. ADH, it targets your kidneys, which causes the reabsorption of water. And that's all for the posterior. Now for the anterior, that has GH, PRL, ACTH, TSH, FSH/LH. So GH targets your general body cells, which causes growth. Now PRL actually causes milk production, so it targets the breasts. ACTH targets the adrenal gland, and the adrenal gland sits on top of the kidneys. Each kidney has an adrenal gland. And that also causes the reabsorption of sodium into the kidneys. But for ACTH, it targets the adrenal gland, which produces cortisol, which then targets your general body cells, and then overall causes healing. Now for TSH, that targets your thyroid hormone, which then produces, your thyroid gland, which then produces thyroid hormone, which is T3 and T4, which then targets the general body cells, and then overall regulates the body metabolic rate. Now for FSH/LH, it targets your gonads. And for females, it makes estrogen, and for males, it makes testosterone. And that is our endocrine project.